So the Achilles tendon is obviously the strongest tendon in the body. It takes all your body weight, and it takes multiples of the body weight in certain activities, like going against gravity, for example. So it is a very common tendon to become injured. Most injuries happen during sports activities, and the most common mechanism of injury is the tendon ruptures during what we call eccentric loading. And eccentric loading means that the muscle would be contracting, but at the same time the tendon is elongating, and the position of the whole limb is forcing the calf muscles to elongate. That puts a lot of tension on the tendon, and that's exactly when the tendon ruptures. Sometimes the tendons can also rupture during simple day-to-day activities like going upstairs or downstairs. Achilles injuries can be classified into so many ways. So if we think of the severity, for example, we can classify them into partial tears and complete tears. So partial tears means that the tendon, part of the tendon is still intact. So obviously here the ends of the tendon do not retract, and that's a good indication that healing can happen in a reasonable position without the need for surgery. Complete tear means that the tendon ends have separated, and therefore a gap starts happening between the two ends. If this gap is quite substantial, then the patient might need surgery. Another way of classifying it is looking at the level of where the tear happens. The most common part of the tendon to rupture is the mid-substance of the tendon, because there is a watershed effect in this area and the circulation of the tendon is not great. But sometimes the tears can happen, or the ruptures can happen a bit higher, involving the calf muscles. These are actually milder usually than ruptures of the actual tendon, and tend to heal a bit faster. Another way of classifying these injuries as well is looking at why the tendon ruptured in the first place. It is very rare for a healthy tendon to rupture. Usually there is an underlying pathology. So things like chronic tendinopathy, a tendon that has been chronically inflamed and unhappy, lays down unhealthy fibers, and this makes the tendon a bit weaker, and therefore the tendon is more susceptible for rupturing. Sometimes ruptures can happen because of an underlying inflammatory problem, for example, like rheumatoid patients that can get tendon ruptures. So if we think of what can be done to minimize the risk of a tendon rupturing, I think we need to think of why did the tendon rupture in the first place. And one of the commonest causes is that the calf muscles are very tight, and therefore putting a lot of tension on the tendon. So a key thing here to prevent a rupture is to make sure that we're working on the calf muscles all the time. They're not tight. We're doing lots of stretching exercises, and this is part of our routine. We all stretch our tendons naturally when we are walking and engaging in day-to-day activities. So it's actually periods of immobilization, like periods of illness, for example, when one is not walking properly or when the activity levels have dropped. These are the times when we really need to focus on doing lots and lots of calf stretches. The second thing that comes to mind here is, how is the tendon loaded? So if the tendon is loaded gradually, usually it builds up good fibers that are very strong and can take our weight with no problems. Whereas if the tendon is loaded over a short period of time, that's when problems can happen. So I always tell my patients to avoid spikes of activities. Now, we all do that sometimes. When the weather is good, we go crazy with the walking, and and then we do nothing for weeks, and then we go on a holiday and go crazy again with activities and so on. This is where the danger happens, and when the tendon is loaded unexpectedly too much. I think another thing to think about as well is how the general health can affect the tendon. So in this point, what comes to mind is we need to always control any chronic illness that we have. And the commonest forms here that relate to this problem are things like rheumatoid arthritis, things like diabetes. These conditions, if they are under control, they minimize risks of ruptures and also minimize the risks of complications if ruptures do happen. We also have to maybe think of how much load is applied on the tendon. So looking after your weight is always something that would reduce the tension in the Achilles tendon. In this respect, also, you need to think of shoes. So if we are wearing stable and supportive shoes, that again minimizes instability. If we are in a situation where the foot is a bit unsteady, naturally all the tendons tighten to give you that stability. The last thing that I would mention here is how people prepare for activities, and particularly sporting activities. So if somebody wants to run a marathon, they need to build up over months and months of training and very gradual build up until they reach the level required for these activities. We see problems all the time when patients are not prepared for an activity and they suddenly take a challenge and load the tendon excessively over a very short period of time, and that is when tendons can rupture. So based on the severity of the rupture, based on the level of the rupture, the age of the patient, and as well the demand of the patient, we would suggest treating the rupture either conservatively or operatively. Conservative treatment means that the patient go through a period of immobilization. Usually the foot is in an equinus position. That means that the foot is pointing downward. That approximates the two ends of the tendon, bringing them closer to each other, and therefore minimizes the gap and allows the tendon to heal without being excessively longer or slack. The patient usually stays in this immobilization for a period of around 8 weeks, during which the foot position is brought gradually back to neutral. And once the healing is okay, they start a rehabilitation process with physiotherapy. The second treatment option is obviously the surgical treatment. And there are different ways of doing surgical treatment for Achilles ruptures. So one of these are direct repair, and a direct repair is usually recommended when there is no gap or the gap is very small between the two tendon ends. It means that the tendon can be sutured directly. If the gap is a little bit longer or bigger, then we start thinking of reconstructions, and that's when we use certain techniques to close that gap. And ultimately, the end of the surgical treatment spectrum is when we do tendon transfers and full reconstructions. That means using a healthy tendon to act as the Achilles tendon, and that is usually used when the tendon is significantly damaged, when the gap is too big to bridge, or if the tendon is quite unhealthy, which means that it wouldn't be able to function in the normal way. So as I mentioned, the Achilles tendon takes all your body weight and multiples of the body weight during day-to-day activities. So it is critical that that tendon is healthy, strong, and of good quality, so that it doesn't re-rupture, doesn't cause pain, and so. Now, if a tendon injury is not treated properly, there are quite a few things that can happen. So the commonest, for example, is when a partial tear is ignored or not healed, treated properly. And what happens is it can progress to a full rupture or a full tear. So making it a much bigger problem to deal with. Re-ruptures. So re-ruptures happen when a tendon tear happens and is treated in a conservative way, and then it heals or it appears to have healed, but the patient starts the rehabilitation maybe too quickly or too fast, loads the tendon back again very quickly, and then the tendon snaps again. The other problem is if the tendon heals too slack, that can make the tendon weak. The calf muscles can become weak. This is a very big problem because it means that one cannot push off with good strength. This would impact the ability of patients to engage in some of the very basic activities like going upstairs, for example. They might find that they cannot run. They might find that they cannot walk for longer distance, and these obviously might need treating operatively. Also, a lot of patients after Achilles tendon injuries can have pain, and pain can happen again for a variety of reasons, one of which is if the tendon again is too tight and is still under a lot of tension.